All of you, thank you for the work that's ongoing. We appreciate it very much. I've got about 45 questions in 7 minutes here, so let me try to get through as many as I can. Mr. Dodaro, just a request for you as well. This Congress changed the W-2 forms and the acceleration of that. Small delay, excuse me, in the returns coming to try to deal with identity theft and to deal with fraud. Is that something a year from now you'll be able to tell us how it went? Obviously, that's just being implemented right now. When do you think we'll get results on that?
Yes, we will review the use of that for this filing season. And I'm very pleased and appreciative that the Congress acted on our recommendation to do that. I think it will be tremendously helpful, and we will report on that.
That's one that should have been done before. We've obviously lost billions of dollars in that over the past several years with the lack of action. For those of us that work in Indian policy, I was a little surprised to be able to see that some of the Indian issues for the first time were on the high-risk list. So my question to you was, is this a new issue or a first time to look at the Indian issues?
It's not the first time to look at the issues. It reached a threshold from my standpoint when I saw it on multiple fronts.
Right.
Schools, healthcare, energy resources, and I thought it was time to elevate the attention.
No, it is clearly a national tragedy on some of the things that are happening in some of the Indian country, and so glad to be able to see it reach that limit. This is something that needs to be addressed. Can I ask specifically on the healthcare side, when you look at the healthcare, are you examining the differences between tribes that run their healthcare or between the Indian Health Service running the healthcare? There are some locations where the tribe builds it or operates a facility, and so really they would all be listed under IHS, but the operational system is very different whether the tribe's running it or whether it's being run nationally.
Yeah. We've been focused on the federal facilities, not the tribe facilities.
Okay, even though they have an IHS footprint there in the middle of it as well.
Right, so far. And we haven't looked at that because of,
That may be a good control to be able to look at at some point, just to be able to examine, because there are some obvious differences between how they run and what's happening, to be able to see the differences as we're looking for solutions long term.
That's a good point.
Vets Healthcare, let me ask about the issue on choice. There's been some conversation ongoing about VA and occasionally giving the appearance, at least, of dragging their feet on implementing choice. And some of the pushback on that. What are you experiencing, and does it look like VA is currently actively implementing the choice program in the locations in the way the law states?
Yes, we've done some reports that we've already issued. We also have some work that's in progress right now. It does appear that progress is being made, like, for instance, with respect to network providers, the physicians who are providing the health care outside of VA. Those numbers have increased fairly dramatically, according to VA. There's still issues there with respect to the choice program that we're looking at. We're looking at access. We're looking at payments as well as the sharing of records. When a veteran goes out into the community, there's an issue in terms of making sure the records get back to VA so that the VA system will have those records as well.
Okay, terrific. Is there a way to be able to get an accurate number of the cost per patient per procedure that actually includes everything the private sector would include? When I've asked VA before for a cost for certain items, capital expenses, all of those things were all different colors of money. Obviously, in the private sector, they can't do that. So we can't really get an accurate cost of what things are, other than it's always more expensive in the private area. But we really can't find out what it is from VA. How do we get that number?
We have not looked into that. I think there would be challenges to getting that, but I certainly will take that back and see whether we can get that done.
Okay, that would be very helpful. Obviously, every business has to do that to be able to calculate what the actual cost is, including their capital costs and depreciation and such. It'd be helpful for us to be able to have an apples-to-apples comparison as we deal with issues in the VA in the days ahead. Mr. Dodaro, the Social Security Administration is not completely done with everything they need to do, especially in the disability area. Very small progress that you've noticed. One of my great frustrations is we've talked with them at length, multiple hearings on the occupational grid. Now, you know full well what that is, but for everyone else here that's tracking that, the occupational grid is basically a big dictionary of all jobs in America, because according to disability, you cannot be employed by any job available in the economy. So since 1978, that list has not been updated. There seems to be some slight changes in our economy since 1978 in the type of jobs. My recollection from your report is We've currently spent $178 million updating the job dictionary of the jobs in America, and we still don't have that dictionary. Is that correct?
I think you're accurate. I'll double check on that area. We're particularly concerned about that they haven't finalized the ability to use assistive technologies in that area. I think personally the Congress needs to act to update some of the disability laws that underpin the process that the Social Security Administration is following. I think if you wait for them to do this job, it's not going to get effectively reformed.
Yeah, I could not agree more, and I would tell you that when we get the grid updated, we need to have a mandate that the grid is periodically updated on a routine basis rather than waiting every 40 years to be able to update it. We might want to update it more often than that, plus do some other disability work that desperately needs to be done. Mr. Thompson, let me ask you about the American Community Survey. Last time you and I talked a little bit about it, you were testing out some pilots on trying to remove some of the mandatory language to see how that would work. Obviously, for people that get it, often hate the American Community Survey. How's that going in the testing and removing some of that mandatory under penalty of law language?
So we have been
Can you turn your microphone on there as well?
Sorry. So we have been working on testing some language. We've actually done some focus groups looking at the language, and we are at the point where we have come up with some language that we believe is not as threatening and is soft. We'd be happy to share that with you.
Great. When will that be piloted? Out in the public?
We've tested it. We're doing an additional test later this year.
Okay, so we've already tested it in the public. We're doing one more test this year, and then we'll be ready to go.
Great. That'd be helpful to see. And on the internet filing for the census, may I assume that you're somehow combining that with the online filing of taxes? Because millions of Americans file their taxes online. Is there a possibility they can also file their census work at the same time they do their taxes? Or are we talking about two different passwords, two different systems, two different requests from people to be able to do their taxes at one point online, but their census at another point?
Right now, we're looking at a separate system for census and for the IRS.
So there's no way that people could fill out their census work while they're also completing their taxes? The information's, obviously, there's not that much.
So we would love to work with the IRS and have them be able to direct people to our site to fill it out, but we haven't.
But they couldn't complete their taxes and also complete their census work?
Not at the current point in time, no, sir.
So not by 2020, certainly, if that's not being tried?
No, sir.
Okay. Thank you.
Senator Tester.